Hi, I'm Dr. Amanda Childress, and I am the Nutritional Healing Center's holistic pharmacist. I am a doctor of pharmacy, also known as a PharmD, and I've been with the Nutritional Healing Center working holistically for the past 10 years. So I decided to make the change based upon seeing from my experience as having really poor health, but also as a clinician, seeing how much the pharmaceutical focused approach is failing people. There's no healing there in most cases. So I actually started the Nutritional Healing Center, and I didn't really know what to expect. I had decided to take the leap to do a more natural approach because my thought was there has to be a better way than what we're doing, and I need to find it. And I found the Nutritional Healing Center. And I remember I started out assisting Dr. Schmidt, and I followed him around and observed him. And I remember very vividly the moment when I decided that I wanted to pursue this as a career for myself. I walked in with Dr. Schmidt into this room, and there was a little old lady, and her hands were gnarled, and she had knuckles about this big. And she told Dr. Schmidt, while she was smiling, "Oh my gosh, I have no more joint pain." And I cut out sugar, and now my pain's gone. And I thought, how can that be? As a pharmacist, I was always taught that with rheumatoid arthritis, which is what she had, once the joints are remodeled, there's really nothing you can do. In that condition, you just want to slow the progression and control the pain with pain relievers as much as possible. So I was kind of floored by the fact that she had so much pain relief from a natural method. So that was really the turning point for me after I started the office, that this was the route I wanted to go. And also, I had many pretty serious health conditions when I started. My health was a wreck. And one of those main concerns was joint pain. I had had joint pain since the time I was 7, and it was a bit of a mystery because they thought I had rheumatoid arthritis because it was so severe, but I didn't. So I went to all these different specialists, and at the University of Virginia, they decided that I must have something called Ehlers-Danlos syndrome. This is a condition where, and it's genetic, in which there are mutations in the genes that affect connective tissue in the body. So they can become too stretchy and elastic and cause the joints to hyperextend, and then the joint damage can occur. There's a lot of other things that this condition can do. There's varying degrees of severity and types, but that was the type I thought I had. And as a result, I was developing osteoarthritis, or the wear and tear kind. So the only thing they needed to do for me was give me heavy medications. So I was on something called NSAIDs, or non-steroidal anti-inflammatory drugs, for many years, from the time I was 7 up through my 20s, until a point where I had to stop. I was developing horrible digestive symptoms. I was having severe acid reflux, so I was taking, Nexium for that, and so many other digestive problems. I was starting to see gastroenterologists and all these other specialists, and taking all these other medications to handle my gut. And then I hit a point in college where I got so sick, and they were pretty certain I had what's called a GI bleed, so bleeding in my intestinal tract from the medications. So I had to stop them altogether. I had to get intravenous iron, and it was pretty severe. I was very compromised from the medications, and all I was trying to do is get some pain relief. And actually, at the end of the day, it offered very little. So I didn't really have high hopes of that improving, but when I started the Nutritional Healing Center, it wasn't long after taking supplements and making dietary changes that my joint pain got tremendously better, and I became way more functional than I ever dreamed possible. So I went from going to the point where, when I was in my 20s, where I wasn't sure how I was going to continue to work in my 30s, I thought I was going to be disabled from joint pain. And the doctors told me the only thing left to do were cortisone shots and heavy narcotics, which I didn't want to do. So I went from there to my joint pain almost never bothering me, which is pretty amazing. So I'm really excited to share this information with you today. So I have a slideshow prepared. And the first thing, oops, let me go back. The first thing on here is a picture of a joint. So often we talk about them, but we don't have Superman goggles to kind of see what's going on in there. But these almost spongy looking stuff that you see on either side, that's the bone, because bone makes a matrix. It's not totally solid if you were to look at it up close. And then in the middle, you've got a capsule, and there's fluid in there, and that keeps things lubricated. And there's cartilage lining it and membranes lining it. So that's a joint. And I really like to define what we're talking about because, I have a lot of patients that come in and say, well, I was diagnosed with arthritis, so there's nothing we can do about it, which isn't true. Arthritis just means inflammation of a joint. The origin of the word is Greek arthron for joint and itis from Greek meaning inflammation. There are over 100 types of arthritis. I'm not going to talk about all of them today, but some of the main ones that we see. So common types of arthritis, there's autoimmune. These tend to be less common than the other types, but honestly, each year we're seeing a higher and higher prevalence of autoimmune-driven conditions. So there's a type called ankylosing spondylitis. There's rheumatoid arthritis, lupus, and psoriatic. And in other types, there's the wear and tear type. That's called osteoarthritis, gout, and then also, believe it or not, hormonal. And sometimes hormonal isn't a standalone problem. In some cases it is, but often hormonal changes will trigger some of these other conditions to flare up. So autoimmune arthritis, this is when the immune system attacks healthy tissue, and in this case, joint tissue, causing chronic inflammation. This tends to affect more the lining of joints, and often there's painful swellings and stiffness. And over time, the joints may actually deform. So that's where you see the crooked hands, the very large joints. You see a lot of the deformities often in the hand joints and in the feet, but it can happen in other areas, especially like knees and wrists. So other organs and systems tend to also be damaged. So in autoimmune conditions, often there's many other areas that are affected or concurrent autoimmune conditions because it really isn't the same in any two patients. It's just wherever the immune system is attacking tends to be where the diagnosis is. Then we have the wear and tear arthritis, osteoarthritis. This is where you often get bone on bone over time, and the protective cartilage at the end of bones wear down. It can be triggered by a past injury or, connective tissue problems. And often people will develop bone spurs over time with this, which is super painful, and sometimes people need surgery for. This can also lead to joint replacements down the road. There's gout. A lot of people have gout for a really long time before they realize it's what it is. And typically that's a buildup of uric acid crystals in joints. Often you'll see high uric acid on blood work during a flare. This is actually often related to kidney stress. So if the body isn't breaking down these crystals efficiently and the kidneys aren't filtering things out efficiently, you'll often see these deposits. So this can come on very suddenly. So there's all of a sudden severe joint pain, especially in a knee or a big toe, and it tends to get really hot, red, and burns. But this can also be more subtle. So some patients maybe, they can have gout-related pain in other joints like their elbow or even their neck, where it's not quite as dramatic, so they don't really realize it is gout. Then we have hormonal joint pain. This comes from hormonal imbalance. The most common, probably the top two, are going to be imbalances in women in estrogen. So when estrogen is too low, estrogen actually can have some anti-inflammatory properties. And in men, when their testosterone gets too low. But the other consideration is high insulin. So insulin's a hormone that's released in response to consumption of sugar and carbohydrates. So if you have high levels of insulin, it's super inflammatory. So that can actually trigger pain in various areas of the body, joint pain being one of them. So in the case of low estrogen, this is why with a lot of women, you'll see that they'll either be flared up or have new joint pain right before and during their menstrual cycle, and also postmenopausal, because those hormone levels start to drop off and the pain gets more severe. And then in men, when they get old, when I have a visit with a man, he says, I'm feeling old. I'm all of a sudden really achy and tired. My stamina's not good. That's often because testosterone has dropped off. So those are the types. So we want to start talking about the way to handle it. And number one is diet, diet, diet. Food can either give you the means to heal your body or inflame and damage it. So the number one rule, if you want to help arthritis, is to take out refined sugar from the diet. So you want a low carb diet, and often you want to do moderate to high fat. So in more severe or more resistant arthritis, you may have to go a bit more specific. So you do a ketogenic diet. The ketogenic diet is typically pretty high in fat, but the most important element to it is that the carbs are super low. Usually you're looking at 20 grams of carbohydrates or less. Then there's the autoimmune paleo. Well, first of all, paleo in some cases is enough to take care of arthritis. Paleo means no refined sugar, no grains, no dairy, and no legumes. So no peanuts. So if anything's sweetened, it's sweetened with maple syrup or honey or, real food-based unprocessed stuff. When you take the next step and do an autoimmune paleo, you also eliminate nightshade vegetables, nuts and seeds, and eggs, which that's not needed in many cases, or maybe only some of those reductions are made. And then there's a diet called the Whole30. And it's paleo, but it's a little bit more strict than that. Because sometimes on paleo, people eat too many carbohydrates still, which can be very inflammatory, if you remember what we talked about insulin earlier. So especially if it's autoimmune, food avoidances are necessary. So gluten and dairy tend to be number one offenders, but in a lot of cases, if the pain is severe and the inflammation is severe, you need to eliminate all grains. And then there's special considerations for gout. No beer. Beer is the absolute worst trigger for gout. It's high in carbohydrates. It is fermented and yeasty, so it tends to be a really big trigger. And then processed meats and processed foods are bad. So I see a lot of patients flare up with gout around football season, because often they're drinking beer, they're eating hot dogs, pizzas, that sort of thing. And that is an absolute no-no if you want to control gout. So if you're looking at this and thinking, well, I'm already low carb or already doing pretty well. I had a big lesson to learn from this, because I had a patient, she was in her 60s, and her two concerns were sinuses and arthritis. And it had improved, but she still had both things. And she was low carb for many, many years. And then I put her on the Whole30 as an experiment, even though it was mostly like she ate. And on the Whole30, her joint pain and her sinus issue went away. So she chose to continue the Whole30 long term. But for her, there was something she was eating, even though she was eating very well, that was still inflaming her. So it's worth exploring these different interventions. So these are the top arthritis supplements, at least from my opinion. Standard Process is a phenomenal company in that they make their supplements from whole foods, so animal products, plant products, and they dehydrate it at a low temperature. So the supplement's nice and clean, and it will last on the shelf, but it still has its nutritional integrity. And it's not just isolates. You've got the whole food complex as it exists in nature. So there's Cataplex ACP. It has whole food vitamin A and C, and also something called P factor, which is an anti-inflammatory component of food. So this is phenomenal for pain and swelling. So I'll often give it after an injury, if something's swollen, or if there's a flare-up, or post-surgically. So in those more acute cases, the dose can be pretty high. We're talking probably anywhere from 6 to 12 a day. They're small little tablets. For otherwise, you may be looking at more like 3 or 4 a day. And then B vitamins can be very, very helpful too. So Cataplex B and G. So B tends to be the more stimulating, energizing version, and G tends to be the more calming, relaxing version. If you want to learn more about that, Dr. Schmidt made a phenomenal video called King of All Supplements, where he talks about the difference between the two. There's also a supplement called Ligaplex 2. There's a Ligaplex 1, which is more for short-term, like an injury, and there's 2 for more chronic. So that's why I choose this one for arthritis. So it's ligament, muscle, joint support, and made out of food. And there's also Cal Ammo. This is especially good if you have a tendency to build up spurs. So Cal Ammo helps establish a good pH in the body, or balanced pH. So that has to do with the acidity versus alkalinity. It's also really good for a lot of skin conditions too, and digestion. Then there's a supplement called Collagen C. It's pretty self-explanatory, collagen and vitamin C. Something called Bios, which is good support for bone, and Offstar Flex. And then other supplements that can be very helpful. I always want to make sure, especially since I practice in Michigan, that my patients have appropriate vitamin D. So I always go with the D3. Always want to make sure there's some vitamin K with it, so that way you integrate it correctly. And there's a powder called Collagen ECM from Systemic Formulas. It's a pretty complete collagen powder with lots of types in there. I believe there's 5 or 6. Actually, it could be up to 7 types of collagen. I'm not sure. But with these different collagen peptides and collagen powders on the market, there's different types. So it may not be complete. And it's something to supplement with, not to get your full protein from, because it's not necessarily got everything you need. But the collagen ECM is pretty complete. That's why I choose it. And Systemic Formulas also makes a supplement called Jot. This is one of my go-tos. A lot of my joint pain people end up on Jot. It has various different herbs and enzymes and anti-inflammatory agents. It's a very, very good catch-all. And then for the inflammation, I recommend boswellia and turmeric. Ooh, I'm missing an R there. But my favorite is there's a MediHerb boswellia, which is on my standard process. And it not only has boswellia, but it has a little bit of turmeric. It has celery seed and ginger in it. So really nice complex. It's really effective. I typically have patients take at least 2 a day, sometimes more. It's usually 2 to 4. And you need to take it consistently if you've been in pain for a long time to kind of break that pain cycle before you'll really see the improvement. So taking it consistently for at least a month before you make a decision about if it's helping or not. And then there's turmeric forte from Standard Process. Turmeric, you can eat it and do lots of things with it, but on its own, it's not that well absorbed. You typically need to put some sort of spice with it to direct your body to use it. A lot of it's put with black pepper, but a lot of people with chronic pain don't necessarily tolerate the black pepper that great. So I like turmeric forte because it's got fenugreek in it, which doesn't tend to be as reactive in most individuals. We have Pro Omega CRP. This is an omega-3 supplement, so fish oil. It's also got curcumin in it, which is the active ingredient that helps with inflammation and turmeric. So you put those 2 together and you've got a power duo for reducing inflammation and for joint support. The omega-3s help with lubrication of the joint as well as inflammation. And the curcumin really helps with the inflammatory process. So CRP actually stands for C-reactive protein because this supplement can help lower that. So many years ago, I had my C-reactive protein tested and it was 40. It's actually not supposed to be over 3. So my doctor saw it and said, oh my God, I've never seen that before. I don't even know what to do. So I went on this supplement, and after a couple of months, my C-reactive protein dropped from 40 to 20. So I'm a believer in it, and I use it a lot for various, heart conditions, pain conditions, so for overall support. Now, a lot of times you're going to need some target organ support too, because there's a reason why your joints hurt, and that's determined on a case-by-case basis. And immune support, especially if you are autoimmune. Now, if you're autoimmune, you're going to want some professional support with that because there's certain things you could take that may spur the immune system on too quickly or overactivate it. So you want to make sure it's appropriate to whatever you have going on. Then there's a cream called Oxycell that I love. The main component of this is something called glutathione. Glutathione is needed as an antioxidant at a cellular level. So this delivers it directly into the skin and the tissue. And I'll usually recommend this if there's a particular area, especially in hands, like if there's a finger joint that's swollen, if someone's developed a swollen cyst there, and even sometimes if you get those like tight, dense tissues in the hand, it's right under the fingers. A lot of times I'll have people rub Oxycell on that, and often over the longer term, we'll start to see those tissues soften up and sometimes even shrink. Gout has a special set of supplements. Some of the other ones may apply to it, but these are the ones we typically use. So AC carbamide is the #1 gout supplement. In my opinion, I've seen lots of gout improve with this. So often someone will take 3 or 4 a day for prevention. If there's a flare-up, they may take 6 or more a day to get that under control. It's also really good for the skin, the eyes, and the urinary tract, actually. There's also PhosFood, which is food-grade phosphorus. And you drink it, it's really, really sour. And what this does is it helps to break down those crystals. And it also serves as a good liver, gallbladder flush, but can also help clean up the kidneys too, so they don't get jammed. So this is a phenomenal supplement. And then there's Arginex. Arginex is, think of it like scrubbing bubbles for the kidneys. That's why I like to refer to it. So it helps to keep them nice and clean and filtering well. And Alboplex, which is kidney support. So all of these 4 are standard process. I have a couple of non-standard process. One is an herbal tincture called Buco, which helps to cleanse the kidneys, and something called KDIR, which is an herbal blend that helps to flush the kidneys. So it can also serve as a diuretic if someone tends to be swollen or, holding fluid. So other considerations when it comes to joint pain. Glucosamine and chondroitin, we hear a lot about that. There's some of that in the Ligaplex 2 I told you about, and in Jot. It may be helpful if you just go out and buy glucosamine and chondroitin supplement. One thing you need to know is you can take it, but once you stop getting the benefit. So it doesn't actually do the long term for you. It's something that you'll need to keep doing. And then a lot of cases actually need to supplement minerals. I have one patient, he's a fairly young guy, he's very active. He gets a lot of knee pain, especially if he does a lot of hiking. But a mineral called Mintran actually takes care of his knee pain, which is pretty impressive. And you may have to address hidden infection or toxicity. So this is a whole other workshop in and of itself. The most common infections I see that cause joint pain are going to be parasites. I see a lot of that, especially if there's jaw pain or tooth grinding. But this can translate to other joints too. And then also bugs that are associated with Lyme cause a lot of joint problems. Like a lot of times when people have Lyme, they'll get swollen knees. And then toxicity. So a lot of toxins can affect the joint too. An example of this is glyphosate, also known as Roundup. It really loves to get into joints and bone. Will actually integrate into it and displace other things you need to have healthy joints, and can over time help expedite the breakdown of those tissues. So you may have to clean those up too. We've all been exposed to it. One of the, people still go out and spray their lawns. It's pesticides used in on a lot of the food supply. But also, if you eat grains, you're getting exposed, especially if they're not organic. So that's a huge problem, and probably one of the big reasons why so many people now have trouble with wheat and grains. So the other thing that's very important to know about when you have arthritis is exercise. The how you exercise is very important. You want to make sure you do low impact. So if you go out and try to run, you're really going to do a lot of pounding on those joints, which can actually flare you up. So it's important that whatever it is, it's smooth gliding motions rather than pounding. So swimming is great because it takes all the pressure off the joints. And then also like recumbent or stationary bikes are very good, or even normal kind of bike because it's smooth rolling motions. The same for the elliptical machine. So you want to make sure you're exercising because it's good for circulation and also helping with joint lubrication. A lot of patients, if they, start biking regularly, a lot of knee pain much better. So it just helps things get loosened up too, because if things are immobile, they tend to get really tense and tight. Then also light weight bearing exercise, especially targeting muscles around the joints. So especially if you tend to hyperextend, it's really important that you keep the other tissues surrounding the joints very strong so that they help keep the joint in place. So make sure you do your exercise. Often yoga can be helpful, but if you're one of these people who tend to hyperextend, you have to be careful with your technique. So there's also structural issues that can play a role. So if you have misalignment of the skeletal system and muscle imbalances, this can very much contribute, even if it's not the main cause. So you'll need to address that. So you may need chiropractic and or applied kinesiology to fully recover. So typically I'll tell people, priority number 1, work on your diet. Priority number 2, get on the right healing program with supplements and lifestyle, and then attack the chiropractic or applied kinesiology. Because at that point, hopefully your body's disinflamed enough where you hold your adjustments better. We actually have Dr. Vickers in our office. He is phenomenal at applied kinesiology. So a lot of times with chiropractic, there's a lot of spinal adjustments, but there's not much done for other joints, but Dr. Vickers is able to work on those other areas. So that was your rundown about joints. I know I covered a whole lot. It's a pretty broad topic. I hope you learned something. If you need help with your joint pain, you're welcome to schedule an appointment with me. You can call the Nutritional Healing Center. The phone number is on the slide. But honestly, diet's number 1, so you've got your priorities figured out so you can get started. Thank you very much.